Look, we should put our fingers in the epigastric region and ask our patient to make a deep inspiration and stop breathing. Breathe, please. What happens with the heart on the top of inspiration?
Push down.
Hmm?
Push down.
Push what?
Down.
Push up?
Down.
Push down, of course. Push down, yes. Together with diaphragm, yes?
Yes.
And the pulsation due to dilatation of right ventricle becomes more intensive, yes, on the top of inspiration. Understand?
Yes.
The opposite situation with pulsation of abdominal aorta. The motions of diaphragm shifts aorta to the back, and the pulsation from abdominal aorta becomes less intensive or absent. This is the difference between normal and pathological heart. Next step. The pulsations of big vessels. Yes? Can I? Yeah. The projection of aorta to the anterior surface of thorax is the second intercostal space to the right from sternum. Look, guys. The second intercostal space is a long region, yes? You should put your fingers not here, not here. In the point as the sternum finish. Sternum, intercostal space in this point. Pulmonary artery, second intercostal space to the left from sternum. Yes. This is the ascendens part of aorta, lung, pulmonary artery, and the jugular region, the arcus of aorta. First of all, we should make the palpation with the help of all our palm. I don't feel any pulsations, but I should check up myself. Aortal point. Arcus out of aortal. Pulmonary artery. Yes, that's all. Once again, from the beginning to the ending. First step is the finding of apex pulsation. First of all, with the help of my palm, and check up myself with the help of my finger. Heart impulse. Epigastric pulsation. Without comment. Once again, breathe out. Breathing. Stop breathing. Breathe, please. Vessels pulsation. Second intercostal space. Jugular region. Second intercostal space to the left. My conclusion. The apex impulse is palpated in the fifth intercostal space, in the point on 2 centimeters to the medium line from the left medial clavicular line. Not extra intensive, not spreading, it's normal. The heart impulse is not palpated, it's normal too. I feel the small epigastric pulsation which decreases on the top of deep inspiration. This is the pulsation of abdominal part of aorta, it's normal. And the pulsation from big vessels are not palpated, it's normal too. Your questions?
Teacher, when we feel for the vessel,
During the different pathology, tell me please, when can we find the pulsation of ascendance part of aorta? First of all, yes, the most often reason, the arterial hypertension, high blood pressure in aorta, yes. And the second reason, atherosclerosis, of course. Atherosclerosis. The walls of aorta become not so smooth, and the vibrations from these walls we begin to feel. What's happened with pulmonary artery when we begin to feel the pulsation on the point of pulmonary artery? Practically the same situation. Pulmonary hypertension. Tell me please, how many types of pulmonary hypertension do we know? A little bit louder. What are the differences between all these types?
Blood pressure.
Blood pressure, yes. The level of pressure in pulmonary artery is the most thing, yes, for divided the pulmonary hypertension in how many types? Three? Two. Yes. Acute and chronic. Yes. Or active and passive. Or venosal and arterial. And what does it mean, passive pulmonary hypertension?